Hey family, it's Dr. Yola with a COVID-19 update. As you've likely heard, we've now entered into what's called a pandemic. And although it sounds scary, a pandemic is no reason to panic. When you hear pandemic, you think like pandemonium, but that's not the case. It's a classic public health term to describe the state of an infectious disease. We have three different terms that describe situations when we are exposed to infections as we are with COVID-19. Epidemic, pandemic, and endemic. Epidemic simply means that there is an infectious agent that's causing widespread infection in a large number of people in a specific area. What we saw in China, what we saw as it progressed towards the United States. Once you have widespread infection rates across the world, now that COVID-19 is literally in every single continent, we now classify it as a pandemic. It's a way in which we truly understand how widespread the infection is. The next term that we use is something called endemic. That describes infectious organisms that are a normal part of our exposure. Cold viruses, flu viruses, those are what we would classify as endemic. It's something that we either see seasonally or yearly, and we run the risk of being exposed and having an infection. We won't know for a while until after all of this has passed as to whether or not COVID-19 will be endemic in our populations. It really depends on how well we're able to control it, how many people are exposed to it. But again, we won't know until later in the next year or so, when we are back in the same time period next year, as to whether or not COVID-19 is going to be endemic in terms of the infections that we are at risk for. Let's talk about travel bans. Now, regardless of what country we avoid entering into the United States, we will continue to be at risk if we as Americans do not practice the 6 hygiene habits that I've talked about over and over again. So I'm going to review them every single time that I do one of these videos. I'm going to review those 6 hygiene habits. The first, wash your hands or use hand sanitizer on all surfaces of your hands. The second, if you cough or sneeze in the crease of your arm, just like this. Not your hand, not over your shoulder. Any of those things put us at risk. The COVID-19 virus is transmitted through respiratory droplets. It's a blessing that it's not aerosolized, meaning that if I sneeze and those microorganisms sit in the air, that you're at risk. That's what happens with the flu. I can sneeze and that airspace will sit for minutes. Someone walks through that space, they can be affected with the flu. With COVID-19, it's truly those respiratory droplets, the things that land on doorknobs, on cell phones, you name it, the wetness of your hand, the spittle that sprays out when someone sneezes and doesn't cover. That's why it's imperative to cover when you sneeze or cough. The third is to try to avoid surfaces where those respiratory droplets may land as much as you can. If you cannot avoid it, wipe it down. If you cannot wipe it down, make sure you wash your hands after you make contact with it. The next is to avoid contact with your eyes, your nose, and your mouth. Those respiratory droplets that make contact with your hand and then you touch your eyes, your nose, and your mouth increase your risk of acquiring the infection. The next is to avoid hand-to-hand contact with individuals because people are nasty and don't wash their hands. I'll give you an example. Yesterday I was at a meeting, a young lady blows her nose, she throws the tissue away, she looks ill. The next thing she does is touches the handle. Now she could have easily washed her hands, used one of the tissues that she used to had on her person to blow her nose, but she didn't think to protect other people. So I made sure to remind her of good hygiene, but then I sat there for a while to let other people know that that door handle was contaminated and that they needed to use their forearm, coat, sleeve, whatever to protect themselves. There were no wipes available for me to be able to clean it off, but it was my duty as a physician to try my best to protect people from acquiring whatever cootie she had. So make sure that when you see something, say something. You can do it in a very loving way. Offer somebody a squirt of hand sanitizer, because I know y'all out there hoarding it. So offer somebody some hand sanitizer. Remind them that we are responsible for decreasing the risk of transmission. The last but most important thing is to stay at home if you're sick. If you have a cough and a fever, I implore you to stay home. I know it's easier said than done, particularly for those of you who may not have paid sick leave, but here's your opportunity to advocate for yourself. Right now in Congress, there is a bill to cover paid sick leave. Use your voice and make sure that it passes. Here's our opportunity for advocacy. So I'll get off my political soapbox for at least a second. to continue in terms of our conversation. Now let's talk about flu versus coronavirus 2019. That's the question that I keep getting over and over again. How does flu compare to COVID-19? Isn't it the same, and why are people tripping? It's not the same. It is absolutely not the same. When you have a flu infection, you feel sick. You have a fever, muscle aches, likely cough, and you might even have some GI symptoms. You go to see me, I will test you on the spot for the flu. You will leave my health center knowing that you have the flu. You will leave there likely with a prescription. You'll get better. You'll finally go back to work once you have recovered. With COVID-19, it's not that clear cut. You can be anywhere from the 80% of people who have very mild symptoms, like Tom Hanks and his wife, all the way through to shortness of breath, fever, and cough, where it brings you to the hospital, which is about 14% of the population, or severely ill, which is about 6% of the population that acquires COVID-19. So we don't know. You could be walking around with a mild cold and be spreading COVID-19. So my recommendation is to assume that everyone has COVID-19. Now, the other challenge comparing the flu to COVID-19 is that we don't have the capacity to test in the way that we do for the flu. Again, when you come to see me, I swab you, I send the test for the flu right then and there. Within maybe 5 minutes, you know you have the flu. Our hands have been tied as healthcare professionals in terms of our ability to test for COVID-19. Initially, it was to only test those who had traveled to high-risk countries, or who had been in contact with a positive coronavirus 2019 test, or patient who's actually had a positive test. Now they've expanded our ability to test to those who are already in the hospital that demonstrate symptoms, are elderly, are individuals with chronic diseases or significant chronic diseases, and those who are immunocompromised. The challenge is that we don't have the ability to test individuals who also have cough and fever, like one of my patients earlier this week. I tried to maneuver to get this patient tested because I had high clinical suspicion. I couldn't test them through the state departments because they have a limited number of tests. And although the requirements for testing have loosened, health departments are still following those risk factor criteria. LabCorp and Quest are now offering those tests, but the challenge there is, one, a healthcare provider needs to make sure that they have the environment that's safe for them and their patients to test for COVID-19. And these institutions, these organizations aren't necessarily reporting back to the state health departments, so we truly won't know how many people are walking around with COVID-19, which is very important, one, from an epidemiologic standpoint, but also in terms of calculating things like death rate. So it's important for us to truly know how many people are walking around with COVID-19. And that was the ability that Tom Hanks and his wife had in Australia. They felt slightly ill, had some muscle aches, some fever and cough, were able to present and had their tests done. So prayerfully, we'll be able to use our clinical discretion to be able to test, as opposed to having to follow these strict requirements. As updates happen, I will definitely keep you posted. Right now, the best sources of information are your state's health departments, the World Health Organization, academic institutions in the way of public health schools like Johns Hopkins, Milken Institute School of Public Health. I know it's a scary time. We've seen the NBA cancel the basketball season. We're seeing the NCAA transition over to sort of this virtual NCAA tournament. It's not meant to scare, but to protect. When we can't trust people to wash their hands and protect each other, we have to take measures to control the spread of the virus. So I'm asking each of you to do your job in making sure that you individually and as a community decrease the spread, but also make sure that you're not panicked about hearing terms like pandemic, seeing things happen. It's really, truly for our protection. Any questions that you have, feel free to post on this link. I will continue to update you as I hear more information. Dr. Yola out.